Can you give us your name and your title?
Absolutely. I'm Dr. RJY3132012.m4v. I'm the medical director here at St. Joseph's Medical Center in the ER.
And we'd like to ask you some questions concerning the Virtual Doctor Scribe program. And my name is Simon Gongora, and I'm President and CEO of Medfix Telehealth, Inc., and also based out here in Houston, Texas. And here recently, in the last week or so, we've started the program, the Virtual Doctor Scribe program here at your emergency room. And as a matter of fact, this Sunday was the very first day. Can you tell us what was the most notable feature about the Virtual Doctor Scribe program here at St. Joseph?
Well, I think like most emergency room physicians, we all want to be efficient and effective and manage emergency medical conditions as efficiently as possible. We know that we need to document effectively everything that we do, not only for the quality of care, but also for reimbursement and medical legal issues. Many times the documentation on an EMR takes away our time, time that we could better serve being next to the patient, comforting them, touching them, and letting them know that we're going to manage their illness or injury as effectively as possible. What I noticed the most was that I was able to be there in front of the patient instead of in front of the computer screen. And that made me more effective and efficient and able to breeze through many patients. Unlike previously without scribes, it was a little bit harder to spend the time on the computer documenting on the EMR.
We haven't calculated any stats or any numbers, but do you feel that with your experience with using scribes, were you able to see more patients by having the Virtual Doctor Scribe help you?
Absolutely. Again, I don't have the exact numbers on hand, but even when I was signing off on the computer screen, instead of a half a page, it was a full page, and I think over a full page of patients that I saw. So I'm pretty sure I saw at least 2.5, maybe 3 patients per hour, when previously I was seeing maybe right a little bit under 2 patients per hour. And these were high acuity cases with about a 30 to 35% admission rate. So again, without the numbers, I can't tell you specifically, but it seemed like more patients. The other thing was at the end of the shift, I wasn't fatigued. I mean, I felt good about my flow. I felt in the moment, being able to take care of patients more effectively without stressing out, sort of documenting everything that I had asked and done with the patient.
And the fact that our scribes, Dr. Ibarra, that they are at least senior medical students and most of them are graduated MDs, how does that fact play into them working as scribes and here assisting you as a scribe?
Sure. At the beginning when I got to know my scribe, we exchanged that type of personal information or training and background. I felt confident that I didn't have to explain, technical terms to them. They picked up on those very well. As I read over the documentation, they had good spelling. They were able to put the picture together exactly as I mentioned it to them. I didn't have to stop to explain what that word was. So I felt very good that they were competent with the medical lingo. And they spoke perfect English, and it was just a good experience.
Yeah, that's great news to hear. And you're new to the position here as medical director at St. Joseph Hospital.
Yes.
What are some, ways that you'd like to use the scribe now that you've been using it for just a very short time and you've seen the benefits of the scribe program? How do you envision the scribe program helping the emergency room now in your new capacity as medical director?
Well, that's true. We hospital physician partners took over the contract on December the 6th, and I started on December the 7th. I had worked here previously as the medical director. What I've noticed was there was a lot more complexity now. We also had some staffing changes, and we reduced the number of doctor hours and increased the mid-level hours. So There was some system issues as far as door-to-doctor times being not very good and throughput times not being very good. So right away I started developing some strategies to try to improve the performance of those metrics that reflect on customer service and efficiency and ultimately profitability. Although you know, most of the time we don't think of the financial aspects of a contract because I do think about the business aspects of it. I want to improve the efficiency of all the workforce. Very early on we introduced an EMR and at that point we saw diminished performance. There was also some other computer changes and staff changes, so the efficiency of the flow went down. So I'm very happy that this tool of using a scribe will affect that overall flow of the ER. I'm happy to introduce it to my docs as something that says, you know, we are trying to take care of you. One of the main goals for me as being the medical director is to provide a safe work environment that's conducive to people performing at their highest, at their capacity. And most of our ER doctors are residency trained, board certified in emergency room medicine, so they have the capacity to see a lot of patients, high acuity patients, and manage them very quickly. Having a scribe helps them reach that capacity. And if we all are able to do that, then we can manage the flow and improve door-to-doctor times, throughput times, being able to make dispositions for emergency medical conditions as quickly as possible, getting the patient to the right place, either to the room, discharging them home, or to the cath lab, or to surgery. So this tool of using a scribe is, I think, has a lot of promise to improve our efficiency and flow.
Well, that's very, very good news. Well, we hope to visit you once again here in a couple of months or so and review some of the numbers, and we hope to get a good grade on our report card.
Absolutely.
And on behalf of Medfix, we want to thank you for trying out our program, and we certainly are hoping the very best that our scribes will be an asset here to your emergency room.
My pleasure. Thank you so much for bringing the system here.
Yes, sir. Thank you very much, Dr. Ibarra.
Thank you.
Okay, thank you.